Hello, I'm Dr. Becky Lynn. I'm an obstetrician gynecologist, and today I'm going to talk about painful sex, bad cramps, and endometriosis. So for those of you who don't know what endometriosis is, it's when that tissue, the endometrium that you shed each month when you have a period, is found inside your pelvis and inside the abdomen and in any place it's not supposed to be. So these little implants of endometrial tissue end up on the ovary, or they end up on the bladder, or they can sit on the bowel. And weirdly enough, endometriosis has been found in the lungs and strange places, C-section scars. It's kind of weird. But anyway, the problem with endometriosis is that it causes really bad pelvic pain. And the classic history of somebody with endometriosis is that they've always had really bad cramps. Now, just because you have really bad period cramps doesn't mean you have endometriosis. But people with endometriosis tend to have really terrible and painful menstrual cramps. So sometimes people will have a history of such bad cramps that they felt nauseated and that they passed out, or they had to miss work, or they had to miss school because they couldn't bear it anymore. Over time, endometriosis pain tends to become pelvic pain all the time instead of cyclic pain, meaning that it just comes when you're on your period, or it starts a couple days before, or it lasts a couple days after. But eventually, that pain starts to be all the time, and it can be really excruciating. And the reason that I see a lot of patients with endometriosis is because it tends to cause painful sex. It causes what we call dyspareunia, and it's deep dyspareunia, meaning it's not pain that happens on the outside of the vagina or the vulva, it's pain on the inside of the pelvis with deep penetration. So how do you know if you have endometriosis? The problem with making the diagnosis of endometriosis is that the only way you can diagnose it is with laparoscopy. And laparoscopy is where you take a long skinny catheter with a video camera at the end, and this is all surgery, you look inside the abdomen. So you can't see it on ultrasound, you can't see it on CT scan, you can't do an exam and feel endometriosis all over the place. The only way to diagnose this is to put a scope in the belly and look for it, and then you can see it. Now, if you do that, you can also excise endometriosis. Obviously, you have to have a surgeon, an obstetrician gynecologist, and there are obstetrician gynecologists who specialize in removing endometriosis. They're called minimally invasive surgeons, so they do a lot of surgery through that laparoscope, so you don't have to get a big incision on your belly, and they can excise that tissue. And most people do much better as far as the pain goes after they have that procedure. But when somebody comes to my office and they give me a history that sounds like they might have endometriosis, we don't tell everybody they need surgery because surgery has risks to it. So what we usually do is we try different treatments for endometriosis. And if we're really not getting somebody better, then we might go to the operating room to actually look and rule in or rule out endometriosis. So what are some of the common treatments for endo? We call it endo. It's just kind of the shortened gynecologist phrase. The first step is ovulation suppression with birth control or some form of contraception. So anything that prevents your ovaries from releasing an egg and prevents those hormonal fluctuations during the month can help decrease endometriosis related pain. So we could do a birth control pill. And remember, not all birth control is a pill. There's a lot of birth control that is not a pill at all. But you can use a birth control pill for endometriosis, and many people will get better. The pill has a lot of benefits. It lightens your menstrual flow, it lessens your cramps, it decreases your risk for ovarian and colon cancer. So there are many benefits to being on a birth control pill. Of course, all things have risks and side effects. So some of the side effects of the birth control pill are bloating, breast tenderness, headaches. People can run into irregular bleeding, especially if they forget to take the pill. Nothing is without risks and side effects. You can also treat endometriosis with something called the NuvaRing, which is also birth control or contraception. The ring is one of my favorites. It's a little flexible ring. It's not metal, it's not hard, it's very soft. And you put it in the vagina, you leave it there for 3 weeks, and then you take it out for a week, and that's when you have a period. And then you put a new one in each month. It also provides protection against pregnancy, it's contraception or birth control, but it suppresses the pain due to endometriosis. So it almost kills two birds with one stone. It's really easy to put in and take out. You just bend it like this, put it in the vagina, and in 3 weeks when you want to take it out, you put a finger in the vagina and gravity brings it to the opening of the vagina. So you just kind of hook it, for lack of a better word, and pull it out. And then you put a new one in each month. Also, you cannot get the ring in incorrectly. As long as it's in the vagina and not sitting in your underwear, it's working for you. You can also treat endometriosis with a progesterone-containing IUD. Now, this works in a slightly different way. It doesn't prevent your ovaries from ovulating, but if you use something like a Skyla or Liletta or Mirena, any IUD that has progesterone in it can help decrease endometriosis-related pain. And IUDs are these little T-shaped things that go up in the uterus. We put them in the office, and then they can last anywhere from 3 to 5, maybe 7 years. And they're also birth control, they're contraception, so they prevent pregnancy. You can treat endometriosis with Depo-Provera. Depo-Provera, or Depo for short, is the shot that you get every 3 months. It's also birth control, and it suppresses pain from endometriosis. Some people are really lucky and their periods go away altogether with Depo. Other people will run into irregular bleeding and spotting. And unfortunately, Depo is the birth control that makes you gain weight, and it's real weight. It makes you eat more. It's an appetite stimulant. So I personally could never put myself on Depo, but some people do great on it. So those are some of the things that you can do to treat endometriosis. Some people also will develop an ovarian cyst on an ovary that's full of endometriosis. Now those you can see on an ultrasound. So when somebody's having pelvic pain or really bad cramps, we'll sometimes order an ultrasound. And if you have one of these cysts, also known as an endometrioma or a chocolate cyst, then that's something that has to be taken care of surgically. But there are plenty of treatments that you can do for endometriosis pain that will make you feel better and provide contraception, maybe lighten your menstrual flow, and make it so you can actually have pain-free sex. Please like, subscribe, and comment. I really want to hear from you. Bye-bye.